meningioma. So most of the time, this can tend to occur from or arise from arachnoidal cells of the meninges, but of course, it can still occur even in the dura mater as well. So cells are arranged in walls with some containing psammoma bodies. It's a common tumor. There are common tumors in adults, these meningiomas. So tumors are nearly always low grade and produce symptoms by slow compression of underlying brain or spinal cord. So they tend to be low grade. So they usually produce symptoms like headache and so on just by compression of underlying brain or spinal cord. So in this case, in meningioma, mitotic bodies are not common. So there is likely to be normal mitosis. That is, the cells are dividing normally, they are maturing normally. So these mitotic bodies are not common, but they can be there. So psammoma bodies are areas of calcification at the center of the wall. So you have those, the cells arranged in walls, and then in the center of it, we have necrosis, areas of calcification. That is deposition of calcium. So that's what we call a psammoma body. And there you have a diagram on the left of meningioma. Yeah, so you have that tumor there compressing the brain. Yeah, so you have there's there's a good circumscribed. That tumor is well circumscribed. That means there is a good almost formation of a capsule around it, and you can see it's compressing the brain. Of course, this is a diagram, or this is more of a picture of a meningioma that have been excised. So part of the brain have been excised together with the tumor. And you can see the histopathology of a meningioma. You can see those walls, those almost like almost wave-like. You can see those circular arrangement of the cells, and in the middle we have necrosis. And so that's what we'll call, we have psammoma calcification within it. So we have, that's what we call psammoma bodies. We have the syncytial tumor cells there. Then, of course, when you talk about the nervous system, also we talk about the peripheral nerves, and so you can have other things that can affect the peripheral nerve. But we will not go into a lot of details in it. Leprosy, I think, is a condition that is not so common nowadays, but it used to affect peripheral nerves. Of course, one of the effects when you affect the peripheral nerves will be loss of sensation. And that is why such people would have wounds, they will even lose toes, fingers, and so on, because they get injured and they don't have the sensation. They don't feel pain is reduced or completely lost because of the destruction of peripheral nerves. So that was a disease that was common in those days. If you look at the biblical stories, you hear of leprosy. Yeah, and it used to be, if you had leprosy, you would be like an outcast in those days. Of course, schwannoma, remember the Schwann cells, you can have a tumor affecting those Schwann cells. So you can have neurofibromas, that is basically also a tumor that can affect the nerves. You know, the fibrous tissue that is surrounding the nerves. You can have a tumor affecting it, we call it neurofibromas. You can have general peripheral neuropathies. For example, in people who have diabetes that is not well controlled, usually the nerves are affected, the peripheral nerves, and so sometimes they also lose sensation. And that is why in diabetes also can have a situation where people develop wounds and they don't feel pain, and so they end up with infection. And this is one of the things that may lead to even amputation, because they develop what we call peripheral neuropathies. That is, they tend to lose sensation around in the periphery, the digits, and so on. Then, of course, we have intervertebral discs, and I think we did study about it, that when we have disc, we have intervertebral disc. That is the disc between, acting like a cushion between the vertebral bodies. And of course, we can have what we call prolapsed intervertebral disc, whereby this disc basically prolapses and compresses the nerves as they exit the spinal cord. And so somebody may end up with maybe lower back pain or other pains in the peripheries as a result of pressure of these peripheral nerves as they exit because of this prolapsed intervertebral disc. And we talked, of course, the main one that will prolapse will be the nucleus pulposus. Remember, in the vertebral disc, you have the annulus fibrosus, then we have nucleus pulposus. And you can see there, can even result in a compression of the cauda equina in that case, and so you may end up with cauda equina syndrome. So compression of nerve roots, and can result in symptoms. That's just another example of herniated disc, and you can see the nerve as it exits from the spinal cord is being compressed, and so you will have symptoms as a result of that.